Mr. Chairman, as the senior senator from Massachusetts, I feel a special duty to ensure that we do everything possible to protect people from unsafe drugs. Massachusetts was home to the New England Compounding Center, the compounding pharmacy that was responsible for fungal meningitis outbreaks that killed 53 people and made 733 people sick. This outbreak was in part the result of long-standing failures in government regulation at both the state and federal levels, a lack of coordination between state and federal oversight, and a lack of clarity in the existing regulations. This unregulated industry is not a Massachusetts problem, it is a national problem. The current state of our oversight of the compounding industry is outdated and inadequate, and as the data make clear, it represents a continuing threat to public health. I take this threat seriously. Those drugs can go anywhere, and a patient has no way to assess the safety of the pills that a pharmacist hands out or the drugs that a doctor injects into a patient. People count on us to put laws in place that will protect our citizens from this sort of harm. This is one of the most basic functions of regulation. I think a lot of members of this committee recognize that. I'm very pleased that Democrats and Republicans on this committee have been able to come together over the last several months to develop this draft legislation. I'm pleased because we all agree that a tragedy like this should not happen again, that it can be prevented, and it's our job to prevent it. So the question I want to understand, I want to get a little transparency behind this, is exactly the scope of the problem that we're dealing with. We've all concentrated on the New England Compounding Center, and we should. It attracts our attention. But can you tell the committee, Dr. Woodcock, how many patients have been harmed by injury, by infection, or by death since 1997, when Congress first acted to prevent harms associated with compounding?
Certainly. I think the real problem is we don't know. Pew, in their testimony today, has a chart of known outbreaks and known deaths going back over a decade, and also other problems such as blindness, severe injuries, and so forth from compounded products. But because we don't have an inventory or identification of these firms, and it's difficult sometimes to detect the harm at an individual level, we actually don't know.
So, Dr. Woodcock, if I just can, though, I just want to push on a point. I very much appreciate that what you're identifying is that there are some really bad practices out there, and the assumption is those bad practices are causing illness, injury, and possibly even death. The question I wanted to know is how much, and you've told me you don't know, so why don't you know? You're the Federal Drug Administration. Why don't you know how many people have been killed from these drugs?
There's no requirement right now for registration and listing, or which would be telling us who they are, where they are, and what they're making.
So no one has to tell you?
No.
Well, what happens when you ask?
Well, sometimes we can't get the records, particularly the shipping records, and so doing investigations can be difficult or, impeded by refusal to allow us access.
So we're here today because of one tragedy that became public. We don't know how many other people have been made sick. We don't know how many other people
We know there have
died.
been multiple other outbreaks and multiple other episodes of fatalities from compounded products.
But basically, the compounding industry doesn't tell. And so long as they don't tell, we don't have the kind of public scrutiny that causes us to move forward with this kind of legislation. Thank you, Dr. Woodcock. I just want to say, I think it's unconscionable that we have failed to regulate this industry for so long and put the public at risk. And I'm very much committed to working with you, with everyone on this committee, to making sure that we put a stop to this. Thank you.